Hello friends, welcome to Local Mart Doctors. Friends, today we came to Green Park Extension, Touch Therapy. It is a physiotherapy clinic, friends, and today Mr. Saif is with us. He is the owner of this big clinic, I can say. And if you have any kind of issues and you require any kind of therapy related to physiotherapy, so definitely you can come here. And I can say he is a specialist in this line. So friends, today we are going to introduce Mr. Saif with you, and he is going to share his experience, his journey, some therapies, and especially the location of this particular clinic. What are the timings? So let's start with Mr. Saif.
Good evening. My name is Saif, and I have been in this clinic for past 12 years now. I started in 10 November. Earlier I was in Panchsheel Park, running there for around 11 years with my sister. But now we have recently shifted here, and there's another center of ours in Gurgaon Phase 1. So touch therapy was my brainchild along with my sisters, that we started with a dream of serving people with a touch. And when I started working as a therapist after my college, I was always perturbed to know, using the modalities like most of the therapists do, was always disturbing me, because it was a technical glitch. Like anyone can put the machines on you. It doesn't require that bit of technical know-how. So what was I doing there as a therapist? So I always decided to work in hand, and as my background is like, I did my master's from Birmas, my bachelor's from Birmas, master's from Jamia Hamta. That was my gold medalist there, 2008 and 10 batch I was. So I completed my PhD post that, and the journey has been that I was introduced to people who were more in hand. After 2010 onwards, I was working with the team. I was a therapist for Delhi District and District Association (DDCA) for 5 years. Worked there for for under 23 and senior Ranji Trophy teams for multiple years. Thereafter I was taken to UP cricket team, and I worked there for around 4-5 years. In the meantime, I served services on honorary basis because they were playing for Mumbai after 35 years. So I was there with services. And almost all the Olympians from North India, they come to us and we are serving them. Not just Olympians, but entire Indian cricket team who serves from North India, indirectly they are my patients. So, being in cricket, you have to be up and about, and whatever therapy is running in the world, you should know those things beforehand. So whenever you tour somewhere and you come across a therapist, you always learn from them. And I found that people who were working abroad with international players and teams, they were more in hand. In hand means you were using more manual therapy. And it's a real knowledge where what it goes beyond what muscles, bones, nerves and arteries are. It is like, if you touch, you feel the difference between the bodies. And that's how my journey started. So when I was treating patients, I used to, make a mark. Statistical analysis was made. And after 6 months or a year, I used to see that out of 100 patients I treated, 90 got better, but 10 still were missing. So they used to come back to me, or there was somehow an indirect connect that they were not getting better. So my journey took me from question to question. Whatever question I had in my mind, I used to go and ask teachers for a particular discipline about it. And they taught me. I came back and I saw that human body is not only muscle, bones or nerves. It is much beyond that. People have been technically very restricted to what they know. They will only mobilize the muscle, they will only mobilize the bones and the nerve, but they will not look beyond it. So I was introduced to a lot of things like viscera, your intestine, your heart, your lungs, which are also very solid organs placed inside the body, and they have weight also. So in the meantime, when they get rotten or they get diseased or they get pathologized, so pathology leads to restrictions in the fascia, the covering around the entirety. So my teachers taught me that, it's not only what you see, sometimes the diseases like diabetes also makes a change. So I was a little curious, why diabetes is going to make a change in your body. So, diabetes, it crystallizes the prostaglandins in your fascia, and it restricts the body more than any other disease. So if we have to treat a patient's frozen shoulder, it cannot only be manual therapy of the shoulder. It has to do something to deal with diabetes and to look beyond it. So, I have to, people were there to teach me how the pancreas are mobilized, so I went there and I saw out of 10 patients which were not getting better on a scale of 100, 5 got better, but 5 were still not okay. So then I found that, if I have to treat the pancreas, there has to be something to do internally with pancreas. So I had education of nutrition from 2 universities. I did my diploma from a year diploma from IGNU, and then another one, a postgraduate diploma from NIMS University. And I went a little ahead with correcting their diets, correcting their nutrition, correcting their visceral organs, mobilizing their shoulders in a different way which people normally don't do. And out of 100, now the score went up to 97, 98, but still 2 people were missing. So that journey still continues, and I found out the people were there talking about psychology, talking about the emotion aspects. So greats of our society, they introduced me to something called emotional release. So emotion leads to all these traumatic incidences. Like you must have heard in the past, don't talk to your parents about the grief or the death that has happened in your family, because they might just get grieved, and it might lead to some cardiac arrest or some anomaly. So I was more inquisitive as to how can it be. So that also led me to go around the world and find out how people are dealt and talked about, open conversations and feeling about their emotions and how to release them. So a lot of therapies that I got to know were neuro-linguistic programming, NLP, involuntary eye movement therapy. Then there were gestalt therapy, there were logotherapy, there were John Pleasure, so multiple disciplines running together. I was able to treat 99 patients out of 100, but one still is missing. So I did my psychology in second year from IGNU, and that's how the journey is still going on. I can't say that I'm a perfect human, but this journey has been to know about a human body which goes beyond body, muscles and bones. It goes beyond mind. It has to be spiritually guided. So body, mind and soul concept in my thing has to come through the hand. So when I touch a body, I get to know whether it's a visceral dysfunction, I get to know whether it's a neural dysfunction, it is a musculoskeletal dysfunction, or it's an emotional thing. And as you progress and you get and gain experience, you get to know how to deal with people. So you've been here, you see there's no equipment here. You can go to the rehab center. The rehab center is on the lines of Australian standards now. So whenever the patient comes to us for post-surgery and vital dysfunction, so we make them exercise also. And our patient age group ranges from 2 years to 90 years. So we've been dealing with a lot of patients who are 90, who are 85, 80, 75. All the sportsmen, I'm telling you, like most of them, they come to us. So it's not restricted to only corporate people. It's not only restricted to the bureaucrats or the politicians or the likes of sportsmen. It's just goes beyond. So people don't come here only for their neck pain or back pain. They also come for emotional release. They don't come here only for back pain. It can be linked to cholesterol high also. So I guide them, my sister guides them to take care of their diet, of their emotions, and how to incorporate life and exercise in their life. And it's a lifestyle that you need to change. Too much talk, but just to summarize it, 80% of the working population in the world, either they suffer from low back pain or they suffer from cervicogenic headache. So there has to be something which connects everyone. So if it is present in everyone, so what are they suffering from? If anyone who's working in the world is suffering from backache and cervicogenic headache, then there has to be something linked to them. And that something has to be the lifestyle, the posture and the belief that they are carrying. So why not just talk to them and let them know, make them more educated? That's what I am about and my sister is about. We are the pioneers in the field of lymphatic drainage in India, craniosacral therapy in India, visceral therapy in India. We run a lot of institutes here. I've been a visiting professor for 2-3 universities, examiner for multiple master students, and my research papers are under publication now. So I'm planning to write a book, being a therapist with the IPL teams for 4 years, and still on the consulting panel for a lot of cricketers like Tendulkar, Yuvraj, Viru and Raina, Gautam Gambhir for that sake. So, it's like I've been a veteran for around 15 years, it's like over for me. But for me, the journey has still been on and I'm still finding out how much and what can I do for the world.
So Dr. Saif, I would like to know basically for our users. So this clinic, like how you make this clinic something special, something unique in terms of providing the expertise, providing the solution for different therapies, or what kind of patients you treating normally, what kind of experience you having to have on daily basis different customers, and how you treating them. You're doing manual therapies, you're doing some equipment based therapies as well. So in your clinic lots of equipments are available, like cycling and different things, machines, cardio and close trainers. So how you utilizing them actually, these equipments, and what's make you special, what's make you difference different in terms of other physiotherapy clinics?
My journey, like I told you, is like 15, 16 years now. I've been handling this clinic for 12 years. I have 2 clinics now, and I visit multiple states to see my patients. So what's special in this clinic is my hand and my sister's hand. So everything that is in the clinic is my hand. You take everything away, you give me a bed, I can be outside on the road and I can still use and treat you the same. But people are lethargic, they don't come out of their shell. So I have to start a rehab center which quietly matches my ability to heal them. So if you come in pain, I will treat you with my hand without using any modality. So you can't see anything here. So my investment is zero. Why I am hosting this clinic is because a lot of patients, they come in. I don't publicize anything about me. So I have very limited amount of patients who are actually suffering from a lot of dysfunction, like they are being, all the doctor in the world they have been to suggesting surgery, I would try and avoid it. People have been here for complete ACL tears, people have been here for complete meniscus tear, and then they're representing India, they're representing multiple states, and they are wrestlers, they are cricketers, they are footballers, and without ACL they've been rehabilitated. So how can I do that? A lot of research goes in. I've been a PhD myself for biomechanics, and my research was on lower kinematic change. So a lot of research and education goes in. Researchers, they change, new modalities, new techniques, they come. See, whatever machines I have are normal gym machines, okay, but I use them according to my need and requirement. I don't make them bulk up like a big bodybuilder. I make them use intelligently by progressing them gradually. So when a patient who is down with severe low back pain and he cannot stand, he will come to me and I'm going to treat him with my hand. First thing first, I'm going to make him pain free. That is going to take around 2-3 days, 4 days, whatever, depending on the condition. And then gradually we'll make him do the ground exercises, the function exercises. Because one thing I would like to tell my viewers is, rehabilitation is not about lifting weights. It's not about becoming brawny. It's not about reflecting what your external self is. You get injured because the small muscles, which are only 1 inch thick or are in length, called steerers of the body, global stabilizers, they get weak. And whenever you lift more than 5 kgs of weight in gym, it switches off. Okay, if you are lifting more than 2.5 labs of weight, or let's say 5 kgs of weight, the small muscles in and around the joint responsible to move in one direction, they switch off. So heavy weights are not required before 2.5 to 3 months, and only athletes reach their stage. But to make them more confident, there are machines which you can reduce the weight. They can go on with a single plate. They give, the machines give them a little confidence to deal with. But as far as palliative therapy is concerned, my hand has to prove it for them. I have to make sure that the tissues which are tight, which are down with pain, have to get relieved with my hands. So once the palliative therapy works, the pain goes down, then he's confident enough to be taken to any level you wish to. So just to summarize it, what is special in this clinic? My hands. Okay, because I've been educating myself for over 2 decades now, how to gauge whether a person is having high cholesterol, whether a person is having a cardiac block, whether a person is having an infection in lungs or liver or kidneys for that sake. And I have to precisely work with post-cancer patients where I make sure that I gauge the disease, in line. And recently I've been working with stroke patients where people come with the clots, and I deliberately start treating the brain because that's what I'm trained in. And I don't think there's any therapy in India who knows brain therapy. So still learning.
So sir, I want to know basically, as you mentioned about the rehabilitation, so please describe something about rehabilitation, how it works, what's the process of it. Secondly, as you know, today's time, like mainly ladies more than 50 years or 60 years, they having lots of issues in their neck, in their back actually. Even lots of young generation also like working from home in these days, because as you know, as COVID actually. So what special message you would like to give, either if I'm talking about the young generation, or either I'm talking about the like old age men's or women's actually, how they can be active, how they can be healthy and not face this kind of issues where they require any kind of therapy.
So the first question is, what is rehabilitation? Rehab is habitualizing yourself again. Okay, you are getting back to normalcy. If you are in pain, you can't walk. So what would be rehabilitation for you? It's like getting a normal walk would be rehabilitation for you. The first thing first is to get rid of your pain, discomfort, followed by easy functional movements like getting off and on the bed, doing your functional activities to willingly, unwillingly, without pain. So getting back to basics and normal functional level is called rehabilitation. So then followed by walking, followed by jogging and running. So in how many phases is it divided depends upon the severity of a patient's anomaly. If someone is injured, or maybe someone has got surgical intervention, or maybe someone has got a traumatic accident done. So in all the three phases, the conditioning will change. Obviously, because surgical intervention means you have cut and you have sewed. So everything that was removed has been joined back together. So rehabilitation will be quicker in that sense. If you talk about traumatic accident where everything is broken, shattered, something is lost, amputated, obviously the conditioning would not be back to normalcy. And then the third phase is injury. Injury might range from grade 1, 2 or 3. 1 and 2 is he is normal, you just need to bring him back. So depending about the severity, the nature of injury, intensity, it depends upon how long you go. Now the next question is, how would people get better? And what do we tell them how to get better? See, it's a normal schedule. Everything in the world functions at a time. Okay, the most important thing for us to remember as a part of this universe is sun rises from the east, sets in the west. Second thing is it rises at one time, sets at one time. Okay, moon is not seen in the afternoon, it is seen in the evenings. So like everything that blooms in the morning and sets itself and go back to home in the evening, there has to be a time set for every human to work. You have to get early in the morning, set yourself up for exercise, set yourself up for work, come back at time, sleep well, because night God has created to sleep. Okay, so the most important thing for you to be healthy is eat the right thing, sleep the right way, and drink enough so that you become rehydrated. Tension will go away if you come back to discipline yourself.
So sir, my last query, why patients, because you have the big name in the market as we search already about you, so why patients coming to you first thing, and they having any kind of reference, or they come directly after searching about you, so why they coming? This is my direct question, so if you can give some fruitful answer about that.
Good question. Why they do come for me is they are in pain. Okay, they are in discomfort, they want to get better. Who refers them to me is patient who has been here before will be referring them to me. I have no reference from any doctors or for that sake any professional, but I get referrals after working. So people who have got better, they send more and more patients. So when I started working in Panchsheel, there was only one patient who came to me, and all day I was just banging my head on the walls as to why. Then one patient brought 3 brought 13 brought 30, and I'm like, I now pick and choose which patient to address. The most important thing why patients come to me is they come without knowing what is happening with them. Now my word has gone so far that they come in discomfort from Punjab, from Bombay, from Bangalore, from for that sake different countries. Now I've been treating a lot of ministers from Canada. I've had health minister of Canada here. I've had health minister of Afghanistan, education minister of Afghanistan, cultural director of Saudi Arabia, a lot of foreign ambassadors from Korea, Russia. So why people come to me is they trust that if I am in discomfort, they will come to me and I'll treat them. How I make a difference is I don't restrict myself to just see muscle and bones. I see beyond it. I tell them what visceral dysfunction they are having, what cholesterol anomalies they have, what led to what. And diagnosis, like I say, is always the key. If you can correctly diagnose the problem, you have nailed it. Even my mother can treat a patient if she knows what to do. But what to do, like you say, it's summarized in medicine. First 10 years you learn what to do. Next 20 years of your working professional years will determine how to do. And the last decade of your work professionally will be like what not to do. So first 10 years you learn what to do, then how to do, and then what not to do. So I actually have supported, I think I have been in the first stage. I am still learning what to do. Maybe that has been of benefit for patients who are coming from abroad or different states. And referrals, I've never publicized myself. I've never been a marketing person. So people who have been here, they refer it.
So thanks sir, you given us your fruitful time and valuable feedbacks and suggestions for our audience actually. So anyhow, they will get the benefit and they will get the awareness how to be in a correct positions in today's time, and how to fit themselves. So really thanks for this wonderful time. I know this is your business time for you. Patients are waiting outside, but then also given us your wonderful time. So really thanks, and we really appreciate it. We really want to come to you again and again and cover some live therapies as well.
Sure.
So we'll remain in contact with you regarding this matter as well.
Sure.
And friends, आपसे भी रिक्वेस्ट है जितना हो सके हमारे चैनल को सब्सक्राइब कीजिए. आप जितना सब्सक्राइब करेंगे आपको जैसे डॉक्टर सैफ जैसे एक्सपर्टीज से हम मिलवाते रहेंगे, इनसे बात करवाते रहेंगे और आपको बेनिफिट मिलता रहेगा. तो कीप सपोर्टिंग अस, कीप सब्सक्राइबिंग लोकल मार्ट डॉक्टर्स, एंड थैंक्स फॉर वॉचिंग दिस वीडियो.